So the plan today is to talk about network data collection. We're going to talk a little bit about research design, which is probably the first set, a little bit about different kinds of sources, and some about data accuracy. It's really a bucket of things that we can do. And so there's a sort of a long answer and a short answer. The short answer for today is that network data, like most survey data, is really finicky when it comes, if you're on the survey side, when it comes to what you survey respondents are very good at giving you what you ask them for, right? And so what you ask them for, you better be sure it's what you want, right? So if you want one thing to take away from today, that's the story, right? So be really careful about your wording and pretest, pretest, pretest. So that's the thing that if you forget everything else because you haven't had enough coffee, just remember that, all right? All right. So the basic rubric for collecting network data shouldn't be that surprising for the other kinds of data you're used to collecting, right? The question is, what information do you want to collect? And this is really, I think, a design question that you want to start about what's the health outcome you care about. Is it depression? Is it an STD? Is it, like chronic headaches, right? So what is the feature that you care about? And that then leads you to some social mechanism. If I'm interested in STDs, the mechanism is really clear. I have to have some body fluid that moves from one person to another that's infected to a susceptible, right? So that's a really clear mechanism. If it's self-esteem, the mechanism is a little more difficult, right? So is it the case that I need to feel like I'm loved? Do I need to feel like I'm respected? Do I have to have someone I can talk to, right, if I'm in a time of crisis, right? So these kinds of mechanisms are social things that happen down at the individual level that we've encapsulated as some kind of a network feature, right? As some kind of a thing. And what I want you to do, of course, in any of your setting is think very carefully about what that mechanism is. And if you know what the mechanism is, then you usually know what relation you need to collect. Right? So if I need to think about body fluids moving between people, then I need to talk about sex or intravenous drug uses or something like this, right? If I care about social support, then I need to talk about who do you talk to most often, who do you feel loved by, and so forth. And so if you can link your mechanism directly to your data collection, it becomes much easier, right? And so that's the way that in the ideal world you would set up your problem and you'd move forward. Unfortunately, right, we tend to have a different sort of setting. We tend to have this flipped around because oftentimes what we're doing is we're collecting data not for ourselves, right, but for a team of people with mixed outcomes that we care about and lots of different interests. And so this is a characteristic of big data projects like AdHealth or other projects like the National Health and Longitudinal Surveys, right? These things are public goods. And as public goods, we know that researchers are going to be interested in lots of different things, right? So they're going to be interested in everything from suicide to STDs. And so if we want to make sense of some kind of a social network feature, we think that networks matter. And so we're going to have some set of relations that we think might generate lots of different kinds of social mechanisms that we think are the things driving the behaviors and outcomes. Now, the problem with this, of course, is that if you're going to, as you're going to see in a moment, social network name generators and network questions can often be really expensive in terms of the time they take to ask on a survey. And so you can't ask every relation you would like that's nice and that has a nice, neat coupling to every piece you want. Instead, you ask something general, something like, who are your 5 closest friends, right? And friendship is this nice, generalized sort of relation that has lots of ambiguous meanings, which is great, right, from a sort of a lived life experience, but awful from a causal mechanism standpoint, right? And so you don't really know what's driving the outcome. And this is what leads to a lot of ambiguity and a lot of sort of space between the intention and the treatment, if you will, and how we measure things. I think that we want to spend a little bit of time then thinking about what kind of data we collect. The relations themselves are often multi-definitional, and so we want to be really careful about the kinds of questions we ask. A key distinction that I like to think about is perception versus interaction, right? So instead of asking who do you like, you might ask who do you talk with, right? And so you have to, again, this determines on your mechanism you think matters. If you think what is driving it is an affective relation set, then you really don't care who you talk to most of the time. A lot of us spend a time talking to people we don't like, we don't care about, right? And what we really care about are the opinions of people that we might not talk to as frequently, but who really matter to us. Please.
This is a little granular, but what has been your experience with doing, let's say I'm interested in interactions, but I'm interested in who do you talk with, who talks to you, right? Where you're the recipient versus the sender. Is that useful at some points, or is the recall bias just...
Yeah, that's going to depend. So the question was if you have questions about an interaction question, such as who do you talk to, can you also think about questions of who talks to you? Is that fair?
Right.
right? So I know I don't just want the people that I broadcast to, like 60 people in a room. I want the people that also reciprocate or talk to me. I think that my experience has been that if you are very clear with respondents, they can answer the question. Now, it turns out that communication is one of the hardest things to get because people are trying to, this is a series of studies we're going to go over in a moment, communication, and I think it's often because well, we'll get to this in a moment, so I'll get ahead of myself. All right, please.
On the previous slide, you mentioned causal association
Right.
being more difficult. And I know that this is an area that's kind of fuzzy in network analysis because when you're talking about causal mechanisms, you're talking about things that are embedded in different communities of context.
Right.
Are there strategies or readings? I know this is a huge area in
Yeah.
terms of public health and networks to determine what those causal mechanisms are. Is there anything else that you can say or offer some guidance about that?
So the question is, what can we do about causal mechanisms? There's a good sort of work in the literature suggesting that, or a lot of, not good work, no, that's the right phrase. There's a large volume of work in the debate, right, about causal mechanisms. We're going to go into this question in depth on the section on peer influence, and we're going to examine a few case studies. We're basically going to go through the Christakis and Fowler pieces and their critiques and think about what kind of strategies are there. So the short answer is that there are strategies for identifying causal influence in networks. They range from sort of the gold standard of experimental designs to other kinds of what I think are reasonable statistical approaches in the sort of standard bailiwick of things that social sciences do, to specialized approaches such as the Siena models that I think are probably the current sort of best practice for these kinds of things. And we'll talk about those in detail. On the causal set of the questionnaire, right, this is a really much harder problem. And so what we can show with these models or experiments or so forth, that whatever network feature we have, we know if that association from a treatment standpoint generates an outcome that we care about in the classic sort of causal treatment and response feature. What we don't often know is what's going on inside the head of actors or inside the dyad of the interaction. And frankly, what's missing is really good qualitative work. So we just don't have the kind of, relational ethnographies to let people know what people are doing in these relationships and why they matter to them, right? And so I think we've gone past, we've gone sort of one direction on the econometric side, but we haven't gone quite as much on the other. Giovanna, please.
Are you going to talk also about how you know data collection in networks? That also may address.
Yeah, I wasn't going to talk about it in detail, but we can get to it. Yes, please.
I'm wondering if you're going to talk about the validation work for some of these measures, because something like so broad about
Yeah.
who talks to you in terms of when you're collecting that data,
Yeah.
how good or bad that person's day was when you talk to you.
Yeah, we'll come to that in the data action section. That's great points. All right. Okay. This is perfect, right? This is the kind of discussion today's going to be, right? It's fascinating. All right. So, I want to start from so what we're going to do is we're going to work from design, sort of big picture design, down to nitty-gritty details of questions, and then sort of responses and accuracy issues. So from a design standpoint for global network data, the first key feature is this problem is known as the boundary specification problem. You need to know essentially what's the bound of your networks. The assumption of network analysis is that you have the population. And this has been, people sort of don't realize this when they start out. We're used to thinking about sampling. In networks, the first assumption of standard network analysis is I have the census, right? I have the population that's relevant to my world. If you don't have the census, right, then you have the potential for error. Of course, the real problem here is we never have the census, right? We never have all relations that are truly meaningful for whatever problem we care about. And so even if I'm interested, maybe if my interest is in co-voting networks in the Senate, I can say, here are the senators, there are only 100 of them, I know exactly what they're doing. A good critic would come up and say, well, real action's going on with their staffers who are talking to lobbyists, who are talking to investors, right? And so you've lost your boundary already. And so the problem you have to think about is what's the substantive boundary you care about in terms of that sort of maximizes the distinction between the theoretical population and the pragmatic population of getting the research done. And there are two general approaches to this. There's what's known as a realist approach, which is what the network looks like from the actor's point of view, and there's sort of a nominalist point of view, which is what the investigator from the outside comes up and defines when it works from. And then we have local networks, ego networks, if you will, or global networks, the full set. I told you that everything in my world is a 2x2, so my students have learned this by now. So the classic realist idea might be everyone connected to ego in the relative manner. So I want to say everyone who could provide social capital for an individual. Right? So that's the realist piece. It's anybody, if I have a particular problem that I might go to if I need a loan, if I need help with my job decision, or what have you. Right? And that's going to be multiplex. It's going to be huge. It's like it's not everybody on your Facebook page, right? But it's not your 5 closest friends either. And what the distinction between that is really context specific. Similarly, if you think about all relations relative to social action on a global network, if I'm interested in STD transmission, right, that could be everybody on the planet, right, in some sense, right. On the other hand, if I'm interested in community health within a city, really I might care only deeply about the people who have contacts with someone who's also in that city. So there might be a natural bound to that. And in practice, what all these global boundaries are fuzzy. These realist boundaries are fuzzy. They tend not to be nice, sharp edges, the kind of things that we need to do the network analysis that we're doing. And so the nominalist approach instead tries to come up with something that's a nice instrument for this, if you will. It captures 90, 80%, something like that, and then allows us to assess the extent to which that boundary is good or bad. Right? And so a classic example for the ego networks is we define the relations by these things called name generators. Who are your closest friends? Who do you talk to frequently? Who were the last 3 people you had sex with? Right? These are questions that we can generate that are specific enough to get a response, right? And then we hope captures this. And that's where this qualitative work needs to happen and where this pretest work needs to happen to figure out whether or not the relations we're eliciting with our questions are getting what we're hoping to get. Jenny, please.
Is the distinction between local and global who versus how? Because when you say local, you're talking about everyone, who are the actors, identify who these people are. And this could be reading too much into it, but when you're saying global, you're really focused on relation and relational content. Is that?
No, the real distinction between local and global is just whether or not it's ego-centered versus whether or not it's a population-centered. And so in practice, that distinction in terms of a question elicitation might not differ, except until you get over here, right? And so the main difference for the nominalist version of a global network is I define a population instead of a relation. Most of the time, from a network standpoint, most of the time the relations, bless you, the relations are what's driving the boundary specification. So it's everyone's who ever had sex, say, as opposed to all people who live in China, right? So the nominalist set tends to be organizationally bounded for global networks. So schools, institutions, organizations, workplaces, something like that. That's both pragmatic and often relevant, right? So if I'm interested in the things that drive efficient healthcare in a hospital, in those cases, really what I care about are the relations among the physicians in that hospital, and that's a perfectly reasonable set. The fact that many of these physicians might have relations outside the hospital is important information. It tells me something about the cohesion of the hospital, but I probably don't need to know who those people are. Like, I don't need an identifier for them. I just need to know how well bounded that setting is. To give you a sense in practice how these things differ, this is one of the ad health communities, and so in ad health we ask students to name their friends, and then we had 2 schools in every community. We had sometimes multiple schools. We had a junior high and a high school, and we allowed students in the junior high to nominate friends in the high school and vice versa. So it is possible to get relations between the 2, but you can see that the relations are really rare, right? So it wouldn't be an unreasonable choice to say, I'm going to analyze the junior high distinct from the high school. Right? There's some boundary crossing here, right? But it's probably not the kind of thing that's systematic for the rest of the pieces. And so if you were to have a design that said what matters is the school building, because that creates opportunities, foci for interaction, that's a perfectly reasonable thing to do. Right? Now you've created some error, you would have missed these cross ties, but the question is whether those cross ties are relevant, or whether you would get just as much from having the boundary outside. Similarly, some work we've done on physicians, this is what I showed you yesterday. These are physicians. We collected Medicare data on patients in 5 states. I'm showing you the results here from Ohio. And those physicians, those patients go to physicians, and so we can create the network of physicians who share patients, right? If you create the network of physicians who share patients, this is what happens if we bound within one hospital, right? We get about 50 nodes, 50 physicians in that hospital that are connected to each other. But all the patients in Ohio see physicians from every county in the United States. So this is an indicator of how unbounded, right, patient networks are. And so the question is, does it matter that a lot of physicians over here are treating patients who have been treated by physicians in Florida? Well, probably, right? If a physician in Florida makes an error in diagnosis, you have to deal with it, and there's nothing you can do about it. It's external to your control set. So thinking about the healthcare system as bounded within hospitals might not be appropriate for some questions, right? But it might be more appropriate for others. So in practice, what we do is you have to set some kind of pragmatic bound in which it captures the theoretical bulk relevant data, and we then collect data on boundary spanning. And so the classic thing to do is say, who are the friends in your neighborhood, but also do you have other friends? Or say, how often do you nominate, you might say, who are your 5 best school friends, but also do you have any friends outside of school? And that allows you then essentially to have a control variable for the boundary specification problem. It's not a perfect control because you can't enumerate all of relations that might be relevant, but it allows you to then at least have a statistical control for the settings where there are out of sample errors in your pieces. Now there's another version of this that we're going to get to in more detail in a moment, which is called adaptive sampling. And so in adaptive sampling or snowball sampling or responsive-driven sampling, in those cases, your boundary might not be pre-specified. You're actually trying to learn what the population is. And the classic response to sort of finishing this out, and Ted Mao's been doing some nice work on this, is to use essentially a capture-recapture design. You ask people who their friends are. If you've got a certain proportion of new nominations, you keep asking. As your new nominations start to peter out, you figure you've exhausted the population and you can stop. Right? The problem with that is that if you have a very heterogeneous population, you can jump population pieces, and you can keep moving essentially from island to island and getting new sort of refreshes each time and not know it. And so it's never a perfect set. And so oftentimes you have to still set in bounds, like saying I'm going to only have people work within this community or something. And we'll talk about more of that when we go to the RDS in specifically. In the back, Chris, sorry.
I was just going to ask how often does your boundary change once you get the data?
Oftentimes we're very good at redefining our questions around the data we have available. And so that happens quite a lot. And so, I think we know a lot about adolescents who are well-behaved and live in schools, for example. We know almost nothing about dropouts in terms of their network effects, right? There are people who have done, on the other hand, there are people who have done nice studies, Tom Valente and some others have done some really nice studies of homeless youth, right? But they don't follow those kids into high school, right? And so when you define your boundary as who are the networks that are helping to support homeless youth, you miss their contacts with, say, supportive people in school, right? And so these kind of boundary issues do define the questions very strongly, and they undoubtedly bias what we're seeing, right? It just can't not be true. And what we hope for is that we find a way to set these boundaries as clearly as we can. And there are some very nice large-scale studies, like the work that Manoj is going to tell us about on Thursday, about village networks in India, where you've actually, if you have enough money, you can get the entire village, and that's awesome. But it doesn't. For most of us, that's a little beyond our scope. So, okay. All right. So then that leaves us then with sort of a basic series of problems in terms of boundary specifications. And then we have to think a little bit about sort of different ways in which we might do this across our pragmatic sampling settings. The nice thing about collecting data again, we're still at the design level. At the local level, and I've become more and more over the years a real big fan of ego network data. So ego network data, local network data, are data where you've sampled an individual and then you've asked about their respondents. If you have the money, you go out and talk to those respondents and you figure out what they're doing. Otherwise, you ask ego about what those respondents are doing. There's some really strong advantages to ego network data, and particularly in terms of anonymity, and you can use probability samples, right? So it's possible to do standard sampling with the sampling frame and all the rest that you're used to doing. And from that, you can get really nice community mixing levels. So I can talk about things like racial segregation, gender segregation, integration of immigrants, these kinds of things. If I want to ask how category A mixes with category B, all I need is an ego network sample, right? So I don't need to do all the things that and induce all the sort of the hassles that come with global network data collection. On the other hand, if I want to know how something like centrality affects my behavior or the relative support that I have in my network compared to others, the ego network design tends not to be effective. So really think carefully about your question. If your question is designed around thinking about local social capital or local social support or population mixing, then ego networks are really quite valuable. We also now have the ability with some kinds of ego network data to bridge between the two in a simulation. So if we know enough features about the ego network data, we can simulate global networks and get a really good guess of population features, things like how fragile or how resilient the overall population network is. And this has been a boon to doing STD research where you can't get the entire population, but I can get nice samples, I know the properties of those samples, and then simulate from them. Yes?
There is also a way, of course, to combine local and depth, right? Depending on what you're suspecting.
Right.
You can start local and then follow the traits.
Yes.
Of interest, and then follow. So there are different.
No, exactly. These are ideal typical cases, and you can blend them in lots of different ways, right? And so I think the most exciting thing in network sampling now, I think, is the network, so what's called network sampling with memory, which Ted Mao is developing, which is a kind of adaptive snowball sampling where you do an ego networks module along the way. And so this allows you to get some connectivity between the sets through the referral chain, but also to get all the mixing that you get from an ego network sample. You can, for example, also do things where you do a global network survey, where you do a really brief sort of survey, who did you talk to in the last 6 months, and then you pop into the network at strategic points and ask for more detail. Right? So there's lots of things you can do on top of this. The question is what do you hope to get out of it? Please.
What do you do, or what are the limitations when egos nominate each other?
So if you have, from an ego network sample, from a global sample, that's exactly what you want, right? In an ego network sample, that will happen if you have a highly clustered setting, right? So you can't treat each of your ego networks as perfectly independent. It tends to be, if you have a large enough population, then that tends not to be an issue. But if you're doing an ego network sample in a really small setting, then you can get that kind of overlap. That's actually useful information. It allows you to estimate what we call transitivity. So if I nominate you, and you nominate Sula, and then later Sula nominates me or somebody in my network, then we know there's a cluster there. And that cluster allows us to tell something about the segregation that's going on in the network, the clustering segregation that's going on in the network. And that's almost impossible to see if you don't have that kind of reverse nomination.
I guess my other question would be, how would you know, without violating any kind of ethical stipulations, whether or not, with the name generators, whether or not they're nominating someone based on their name or their initials or something like that? How do you get over that?
So how would you identify if they're matching the same people? Yeah, you don't.
Okay.
Yeah. This is a little bit of an aside. One of the problems we're going to talk about in the ethics lunch talk is going to be about this problem that's known as deductive disclosure. That if I know enough about somebody, I can identify them in the population. It turns out that can be a really useful tool for this kind of matching. And so what we actually had a design way back in the day, a subsample of ad health, where we really wanted to find infrequent, weak sexual ties, right? People you've had sex with once or twice maybe, but you wouldn't be considered a committed relationship. The problem is those are really hard people to sample, right? Because you don't want to knock on somebody's door and say, you just got nominated as a sex partner of Billy down the road, and oh wait, no, I wanted to talk to your husband, not you, right? So you don't want that to happen. And so what we came up with, this is a Behrman's design, which really was brilliant. It just didn't get funded. Was you ask a series of questions of people that you could easily learn on a first date. Do you smoke? Do you have a motorcycle? What color is your car? Do you have a pet? Right, a series of 15 innocuous items, each one on their face. Put them out into a string, right? That uniquely identifies somebody. And I can come and knock on the door and say, we're doing a general survey of social science. It includes questions that range from friendship to sexual relations, and we'd like to talk to you because someone in our sample nominated you. So there's no indication of why you got into that sample, but now that I know you, I ask you that same series of questions, and we can do a probabilistic match. And so without ever eliciting a name, we can get identity that way, right? And it was a brilliant design that just didn't get funded to go through for the rest. So if anybody wants to pick it up and do it again, I'd be happy to consult on that project. All right. So let's talk a little bit about, I'm going to go through each of these bits in a little more detail. Ego network sampling is the most common way that is the most familiar type of network sampling that we're used to doing, because it really is just a standard survey set. You ask ego, you sample some ego from some probability frame or some other sampling frame, and you ask the respondent to tell you about their alters. Right? beauty of this is it's really efficient. I can say, who are the last 5 people you've had sex with or some such, and then for each one, it's saying, tell me about Bill, tell me about Joe, tell me about Mary. Typically, you will ask respondents to fill in a name for these folks, because then it's easier in the conversation later, right? So I don't say, tell me about your first friend, because they can't remember the first friend. But if I can say, tell me about Joe, then they can tell you about Joe. The real problem with this is that depending on the characteristics you ask, there's a huge risk of respondent projection. Right? We all think that our friends are more like us than they actually are. And that's true for 2 reasons. One is because we think we're the center of our own movie, and everyone must really like us because we're good. So there's a sort of a basic bias. But there's also an exposure bias, right? So if I'm a smoker, I hang out with my friends. They're more likely to smoke when they're with me than they might otherwise more generally. It's just an amazing feature that the people I hang out with always talk about networks. I can't really figure out what it is, but I can wonder why it's not more general in the population. Please.
Is there a magic number for how many do in these questions?
No. David's done some really nice work on this. It turns out that, and I'll show you the slides from it in a moment. It turns out that the number of questions you ask is probably the best predictor of the number of friends people have. And so it's a really unfortunate feature of these networks. Now the good news is the new techniques are making it better, right? And so the problem with the old style techniques is you had to have a piece of paper and there was a series of lines on it, right? And if I'm sitting down in front of a test and I see 15 lines, I've got some pressure to fill out 15 names. If I see 3 names, 3 lines, I'll fill out 3 lines. And so there's new adaptive survey technology that was allowing people to say anyone else, for example. So I can say, tell me who your closest friends are. And then you just prompt them as they go, or you list a small number of lines or something, and there's been some work on that. But the honest truth is that the limiting feature in most surveys is that if you're going to get any information out of these people, you have to ask respondents to comment on them, right? So if I have K alters and I want to ask Q attributes of them, I've now generated K times Q new questions on my survey. And this is something that people don't realize when you go, and this is a great trick you can play on your survey construction people. You can say, no, I want to add an ego network module. And says, no, I'm just going to ask about 5 people. Don't worry about it. I'm only going to ask 3 questions about it. And before you know it, you've added an hour module to your set, right? And so these things really compound quickly. And so I would love to know about people's 20 closest friends. But the problem with asking my 20 closest friends is that I end up then adding 100 new survey questions. And so a nice adaptive design is to ask a full roster of these sets, then get really detailed, say, on the closest set and a random sample of others. And so people have used those kind of designs. And so you often get something like, how many people have you texted in the last week? Show me your phone. And so I can look, I can get the entire set and say, of these people, right, who are the people you talk to most? And so there are ways to get around the bias that's built into only having 5 alters, but you got to really work at it to do it. There's a hand in the back? Yeah.
So if you're folding this into like a standards population survey, then you're maybe doing a two-stage cluster sampling, so it's like sample here, random here, random like across all. Does that really affect, because then you're getting essentially just all the same networks in each cluster, and then if you have to calculate all your measures separately for each cluster that you're sampling, or?
Right, so if the beauty of this design is that it really is just like any other survey set. So unless your clusters are exceedingly small in your cluster design or exceedingly dense, you can treat it almost as independent, all right? And so within each cluster, because the likelihood that my alter, if there are, if people have 10 or 20 friends, if there are 10,000 people in a town, the likelihood that our friends overlap are exceedingly small. And so that's fine. If what I'm doing is a really clustered sample, then they might overlap. That's okay from a mixing standpoint. It's still giving you proper mixed, group-to-group mixing, and it's actually at the individual level giving you an accurate picture of what that person's life looks like. You might have a person repeated in your alter set over across multiple features, but in how that sums up to the respondent's average exposure is still perfectly accurate. So that's fine. So there's no issue on that standpoint. If you have respondent weights, then those weights get added to whatever measure you construct, and it's generalized in that set. So actually, this is why the ego networks are so beautiful. Is they're just not that networky, frankly, right? I mean, they're the kind of measure that you can use in a pretty standard way. And so then the beauty of sort of what happens when we do these models of simulating global networks from ego networks, we assume that popular people are going to show up multiple times in other people's networks. That's one of the features of the world that helps us. And so we assume that the degree distribution of the alters matches the degree distributions of our respondents, and so we're going to get some of these people hit multiple times, and that's what allows us to get connectivity at the global level. Jiban.
Also, I mean, these days,
So, I think we can hear you in the front.
thinking about that this time and other approaches, you can actually link nodes in the network. Really, if you ask me to identify information about each of these outcomes, say,
Right.
the last 4 digits of cell phone, right?
Yeah.
This switching.
Yeah. So what Giovanna says is that, I mean, you can in fact identify how often you get these people open if you have just a little bit of minimal identifying information. So if I ask first name and last 4 digits of phone number, right, then you can link those people through. Seth.
So if like an alternative, wouldn't an alternative would be to collect minimum identifying information and then go link to administrative data? That way you would get a whole bunch of characteristics and you wouldn't have the KQ problem.
Yeah, that would be great. If you have that as an alternative, right? If it's possible to link to administrative data from the identities and the administrative data carries the information you want, absolutely. That's a great design, and it lowers your respondent burden a huge amount, and it removes the projection problem, right? And so you don't have this issue of figuring out what are my friends' grades. I can go look them up in the school roster, right? There's often administration is clearly administrative limits to the ability to do that often, but if you can do it, absolutely.
So for example, credit data is public data, you have to buy it.
Yeah.
It's just money.
Right.
And you just need name and address.
Yeah. So, but if you wanted something like, how much do they care about you, you couldn't get that.
But you could at least see if your sample's balanced.
Yes.
Balanced.
Right. No, I think that the extent to which it does raise a question. If you're going to have information that allows you to link other people, that then removes the anonymity side of the IRB or of the human subject set. So you have to be willing to deal with that, which is fine. We have good procedures for doing it, but respondents need to know that ahead of time. Please.
Is there ever a situation where there's an alter that's sort of tangential in the network that might not be listed by the respondent, but who might be present always when they're interacting with someone else if they do name? So the name might come up or the person might be referred to through the course of the survey, but the alter does, or the respondent doesn't necessarily name them specifically. Is it possible, should you collect data on that person as well? Or if they're not perceived as important by the respondent, but it appears that they are, can you kind of would that be important?
The question is, are there people who the respondent might not answer, or might not name, but could be important and are around a lot? I think the answer is yes, there probably are people you'd like to collect. And the question is, how would you do it from ego standpoint? If ego doesn't know it, doesn't recognize it, then you don't see it. There's a person at Arizona State, I'm forgetting her name, she's in the human development section, who's invented a measure which is the association between alters in the presence of ego. And so it might be that John and I hang out all the time when we're with Bill, right? But John and I never hang out otherwise. So from my standpoint, Bill and John and I are all 3 friends, but absent me, Bill and John might never get together, right? And so thinking about those kinds of conditional associations are actually really fun for thinking about things like delinquency. So I might be delinquent in the presence of Bill, but not otherwise generally or some such. But I think that's really hard data to get from an ego standpoint unless you have identifying information. If you have identifying information, then you might know that the people I name somebody else a lot, even if I don't name them directly. Now again, there's the recall, the limitations that come from the number of slots you allot are severe, right? There's always this feature that you never have enough space to do it. And so electronic data collection that's coming online, even for the ego network levels, is extremely helpful. If you can get people to let you see who they've texted in the last week or who they've been, frequently communicating with, that can at least give you a roster of these sets. And there's a great study coming out of Chicago where they've been using, studying men who have sex with men, where they actually pull the SIM cards of people's phones and they just take it off, right? And they can get that information. That's another layer of IRB. You have to make sure that, and you got to get your respondents to trust you to do it, but it's exceedingly accurate, right? Please.
Well, I guess that could also be this thing because I'm interacting with people a lot over Facebook, because they don't actually see them a lot in real life.
Right.
And so that kind of interaction
Right, and it'll be, and this is why the point about really having a model of social mechanisms is so important, right? Because we can sit here and think all day about the kinds of relationships that might matter. It's a great fun exercise, but you really need a sort of a model in your head about what's going on, and ideally grounded in some real data. Now, beyond ego networks, so there's this whole range of things between the pure complete census and an ego network that we're going to refer to as either link tracing designs or adaptive sampling designs or partial network designs. And this is a rich sort of world of data collection. And Giovanna's going to talk a bit about it in a couple days, right? It's 2 days? But the basic idea is to use, you start with some sample of nodes and you then move out from them to the people, to the rest of the network. The beauty of this is it does solve to some degree the boundary specification problem. I don't have to say, only talk about friends in school. I can say, who have you smoked dope with in the last 6 months? And just follow them out, right? And if they're in the school, great. If they're not in the school, that's fine too. The problem with it is that the ways in which you start your seed, right, can really determine the kinds of sample you get. And this is what generated this entire population model called respondent-driven sampling. And the nutshell of respondent-driven sampling is that if you assume this kind of seeding process has a probability model built into it, you can then actually infer to the population under ideal circumstances from your seed. It turns out, of course, that ideal circumstances are really hard to get most of the time. And so there's a huge amount of work that we've been involved with to try to figure out the best way to generate these RDS samples, and I'm going to leave that discussion to later. All right. Okay, I won't. But just know that's out there. All right, so the global network data, remember the assumption is that you have you've enumerated the population of interest and all the relations amongst that population. And so this is actually really hard to do. This is why most of our global network samples tend to be, if they're a survey side, tend to be from really constrained populations like schools or hospitals or organizations, right, where we have a really clear bounds. It's also where we typically use a lot of extant records on things that have really tightly bound, like the Senate or university professors or co-authors or something like this. The beauty of those is that the population is given for you. You know where it is, right? You have it and you can work with it. The problem is that it tends to be, so your boundary tends to never to be as strong as you want. There is one really nice advantage of this, though, which is that if you're doing an enumeration anyway, the network questions themselves tend to be relatively cheap, right? So we did all the Prosper Peers project, which has generated now hundreds of papers. It has 15, 2 states, 2 cohorts, 9 waves of data on adolescents, from 6th grade through high school, on all their behaviors and smoking and all this kind of stuff. They were doing a full census of the population in those settings anyway to evaluate an experimental intervention they were doing. And so we showed up and say, you have a blank page in the back of your survey, and we list who are your 7 closest friends. Right? That's all it took. And with your 7 closest friends and the fact that we then know all the other information from ego self-reports, we have a brilliant network sample. Right? And that kind of thing. So if you're already doing an enumeration for some other administrative purpose, the network questions tend not to be that expensive. Right? You have to, the flip side is it took 1.5 years of 5 graduate students working full time to match the names that the students wrote down by hand, and so that was a bit of a pain in the ass. But hey, that's just graduate student time, so that's fine. And so that's but anyway, that's the nice thing there, because you don't have that. You don't have to rely on the respondent to inform about the alter over and over again. Right. Right. And the beauty of an island is that it has a natural bound, right? I've been arguing with my better half for years that we should do a national level survey of networks, and so I said let's go to Iceland, right? Because Iceland is nicely bound. It's an island. There's no one there, right? And they're all in a large city. And she keeps telling me that Jamaica's an island too. And, then we.
Try Taiwan.
Yeah. Taiwan's too big. All right, so for most of us, we're going to use extant network data because we can't afford to collect our own data. So just know that there's a lot of data out there, and I encourage you to use it. Most of it is not used to its full extent. AdHealth is beautiful now because you can ask questions about things like how people's peer involvement as adolescents affects their later life. Ing Sure, a graduate student here at Duke, just had a paper that is accepted showing that there's a strong relationship between your popularity in high school and your adult income 20 years later, right? So that kind of longitudinal survey where you have embeddedness in networks at time one you can now ask about associations a lot later. And so that's a beauty. So there's lots of things you can do with these data, and so I encourage you to think about them. The most common archival source tends to be these two-mode data, where people are engaged in something as a part of their everyday life, and that creates a common association, right? And so this is the bread and butter of all science studies. So if I want to know the social understanding of science, I can see who's attended a conference together, who's published a paper together, and so forth. But it's also really, I think, valuable for health production questions. So if we really want to ask how health delivery is done, let's figure out what health workers are doing and who they're doing it with. I think there would be a brilliant study to do to look at nursing schedules in hospitals, right? If I want to figure out which nurses work with who on which floor, I have that. It's part of the electronic record for when the nurse signs off on each of these procedures and each visit they go through. So I can actually generate a community of supportive care within each hospital without ever serving anybody and figure out which patients work next to them, and from that, figure out performance, right? And so this is something you can do from a network standpoint. If your theory is that people who work well together provide better care, you can find out, right? But you have to think carefully about what kind of data you can get access to, and some privacy issues, right? The external records don't get rid of your privacy issues, and sometimes they even make them worse. But you don't have to ask surveys or rely on that kind of recall bias. Please.
I just wanted to add for the network data, and I know that most people here are doing individual level stuff, but there's a great organizational data from Danielle Barta at the University of Colorado. It's all local health departments and their connections within the United States, and it's over many years. It was a project that was funded by Robert Wood Johnson.
Oh, great. Would you send us email me that link, and I'll post it to the site so people can have it. One thing that DNAC is going to do over the course of the next year is start creating a data archive for people of these kinds of data. And so if any of you have access to data or suggestions for data, for extant data, we think that, again, these things are being underutilized, so it would be nice to have pieces to that. And we're also trying to work with the Southern Big Data Hub to become a repository for sensitive network data. So if people want to use network data under a protected data network sort of situation, we can provide access to that. And the more of you that ask me to be able to do that, the more pressure I can put on SSRI to do it, and the more likely it'll actually be done. So, all right. So, what time is the session supposed to end? 10:15? 10:15? Well, look at that. All right. I'm doing a mental edit in my head about which of the 30 slides we don't want to talk about today. You guys didn't ask any questions yesterday, and we made it through an hour early, so I figured I had to bulk up here. All right, so this is great. All right, so there's about classic sort of standard elements, right? The key thing that we want to care about from a network standpoint that's unique are these things called name generators and response formats. And so the name generator is the general name for any question that elicits a relationship. And there's many of them out there. Most of them suggest that people are very sensitive to the questions asked, right? So you got to be really careful about that. And a key element is that if you ask multiple relations, right, then you need to make sure that you let respondents know whether or not it's okay to name the same person twice, right? So if I want to say, tell me who your coworkers are, and I list my coworkers, and then it's tell me who your relatives are, they might not appreciate that if you work with a coworker, you should list both people, right? Because respondents couldn't imagine why you would want them to be redundant. And so be clear, for good reason, like they don't want to waste your time, right? So there you have it. The response format can have a huge effect, right? So if you have an open list where you say, just tell me how many people you know, it tends to generate respondent fatigue. And so I'll generate a series of names until I think that you're bored and done, and then I'll stop, right? On the other hand, if what I do is if I enumerate a set of people and say, tell me who you're friends with, people will tend to check it off, and they'll just keep going through, and you'll get an over-report. And so on the one hand, you get an under-report, on the other hand, you get an over-report, and the extent to which these things trade off each other isn't, I think, particularly well known. My sense is that the open list format is probably the better choice, just because it's too easy for people to get response fatigue and just really stay their friends with everyone, and you get the strongest relations here. If that's not your interest, then you should try, again, do something else. Limiting choice, if I say tell me who your 5 friends are as opposed to how many friends you are, caps the degree distribution and the density of the network. Every network statistic is determined to some degree by that feature, and so this is going to bias the network results. That's unfortunate. It's also just, and someone like Carter Butts, who I've, a good friend of mine I've worked with for years, has been railing against fixed limited choice designs for ages. He's never fielded a survey, right? And I've dealt with people who've had to try to do the response bias feature. And so my sense is that what you want is a limited choice that's large enough to capture most people's responses. Right? Is 5 friends enough for an adolescent? Maybe, maybe not. I think the nice thing about 5 close same-sex friends is that that's the number of people who can fit in a car. It's the number of seatbelts in a car, for example. It's the number of seats around a McDonald's table. Right? There are some features that make 5 maybe not an unreasonable number. Right? Would 8 be better? Probably. Would 20 be better? Probably not. And so I think you need to think carefully about the setting and what you expect to get there. We've already talked about that, so I'm going to skip that quickly. So if you do an ego network survey, you typically ask some kind of an ego network name response from who do you talk to. So this is the classic GSS question, which is from time to time. Who do you discuss important matters with? This was the kind of question that was chosen because it's a general question that lots of people can use, right? So it means lots of things to lots of people. It's completely unspecific, and that allows people to answer questions about employment as well as to answer questions about health. That also means that kind of fuzziness about the mechanism is completely left unspecified. Then you typically go through and you say for each person you've named, tell me how often persons 1 and 2, persons 1 and 3, persons 1 and 4 communicate with each other. If you do this on the phone, it can be a little tedious. New designs are making it easier. If you do it online, for example, you can ask people how often are the 2 people any of these things. And so the online or otherwise computer-assisted data sort of features make these kinds of questions much more efficient than if you do them face-to-face or if you do them over the phone. Nope, escape there. Pen and paper surveys are comforting to respondents. They know it's there, but you got to be really careful what you're doing. This is an actual picture of the Ad Health instrument. So this is what the in-school instrument looked like. And think for a moment about the cognitive task that adolescents were faced with. Right? They had to think of their 5 friends. They had to look them up in a telephone book that was sorted by age and gender. They had to fill in the scan-on sheet and hopefully we didn't make any mistakes and then say something about each one. Right? It's kind of remarkable we find anything with these data. And people, whenever I see a dozen high school kids, goofing off at the mall, I sort of am amazed that this is actually the data I built my career on. So this is a really complicated design survey, and you think about also the features of building the roster ahead of time. We had kids moving in and out and so forth. So these types of features are expensive. They're hard for people to do, and thankfully we don't have to do them anymore. And so the online data collection and the automated data collection makes this much easier than it used to be. Please.
Question about sample size. I know when we're doing social network analysis, like the density largely, matters in terms of who is reported. But I'm curious about the number of egos that you interview, for example, for egocentric network analysis. Is it like on average, how many egos? Mm-hmm.
So the question is
publication and things like that.
The question is about the sample size for an ego network survey, for example. The beauty of an ego network survey is that it follows all the same. At the end of the day, what you're doing is you're constructing a case level measure. And so it follows all the same power questions and power calculations and sample size issues that you do in a normal setting. For a global network survey, the thing that people don't realize is I might collect respondent information on 2,000 adolescents, but that's one network. Right, and so global network studies are effectively case studies, and so this is why this is what makes Ad Health and Proster and some of these other big projects so amazing. Is that you now have 120 networks, right, as opposed to one network. Even if it took 70,000 respondents to get that, but that's the advantage of being comparison.
So related to that, I hear you in terms of the power calculations, but since we're not potentially going to be doing standard regressions and all of that too,
right. Again, for an ego network survey, you typically are doing a standard regression.
So you can.
Yes. For something like again, for the global network stats, it's a different question entirely. But we'll get to that another time. All right, so I'm going to do. I really want to. Michelle has a nice new. Her team has developed a new data input feature, and I'd really like us to see it. And I think that's going to be a little more important than going over some of these data accuracy issues that I have in here right now. I'm going to sneak the data accuracy issues back into one of the other presentations, probably on the randomization day, which is tomorrow afternoon, because I think it is important to get at it. The basic issue is that there's a whole series of studies that were done in the 70s and 80s that basically said survey network data sucked, that they were awful. And Bernard, Kilworth, and Saylor in these informant accuracy papers really put a hammer into saying, well, what's wrong with the network data? And they did this by identifying places where we had records of communication and then asking people about communication. So they'd find ham radio operators, for example. They could then record how often ham radio operators talk to each other, and then they'd go ask them how often you talk to each other. And they were wrong about 50% of the time. And then they did this this is my favorite, they literally had 7 different papers that were published with the same title. So it's you can find the papers well. It's Informant Accuracy 1 through 7 with different arguments. And Jeff Smith and I now have Network Data Error 2, and we're working on 3. My goal is to at least to beat this someday. But we'll see if we can get there. That said, so that was the bad news. And then a bunch of people worked for years on figuring this out. And Jimmy Adams and I worked on this with the Colorado Springs data. And we had just the opposite finding with these data. With these data, we have a lot of information about when a person we ask things like, who did you have sex with in the last 6 months? And there's a lot of errors that can be built, a lot of responses that can look like errors because data was collected over a year. And so there are some cases where these things couldn't overlap. And so once you sort of sorted it down to cases where you could get a match, given the time windows, in fact, we were getting matches up to 80%, right? And so this is really a testament about knowing the way the data is generated. And so if you know your data generation function and you ask respondents very careful questions, they will tend to answer them. Now, the issue with these data is that the Colorado Springs data that were collected were an incredible effort on the part of incredibly dedicated, highly trusted public health researchers. John Potterett and his crew had been in this community for 20 years. They knew everybody by name, they knew all the players, and they trusted them. And so those people were able to get good, honest responses that seemed to be very, very accurate in terms of the ability to answer very detailed questions, both about each other and also about these kind of matrix ties where I ask you about alters, how often did they get picked up, right? So these were really well done data collection. It's the kind of effort that you have to build a career on a single data set to do. And so it's the kind of thing that it does say it is possible to elicit these kind of good data, but you can't do it cheap and shoddy and on the cheap. So with that said, I'm going to stop on this side. It's much better now than it was ever writing. I mean, you can still get great network data by having people write down names, and it's cheap, it's easy, they know how to do it, there's no problem with it in administrative context, but you then have to do all the back work of matching it, and that's not a trivial task. When kids write down Jesus as their best friend, and we got a couple of Santa Claus, right? So those kinds of things, you got to be careful with forgetting, right? So those are the types of things that. It's not clear that someone couldn't still write down Santa Claus as their best friend here, but the map might not extend to where he lives. So that's, before we break then, questions, comments, thoughts, sort of burning issues people might want to pay attention to. We're going to come back to data is fundamentals. We're going to come back to the data issues and data collection issues in the ethics sect. We're going to come back to it in RDS. We're going to come back to it in randomization. And we're going to come back to it in the peer influence feature. Again, as I said at the beginning, the main issue is if you're collecting your own data, be very clear about what your theoretical model is for how the health outcome depends on a social mechanism that then drives the question. And if you have to go the other way because you're using Xing data, think very carefully about what kind of social mechanisms are embedded in the relationships that have been collected for you so that you can essentially test the counterfactuals as best you can. Awesome. All right, let's take a few minutes. I'm going to use the restrooms, get some coffee, make a new friend. And come on back.